Websites like Kickstarter are becoming a popular way to raise money for everything from indie films to garage bands. But what about crowdfunding for health care? Dean Reynolds sat down with a woman who's counting on it.
How's this spot right here?
That feels really numb today.
Oh, it does.
Mm-hmm.
28-year-old Amelia Cafaro is in the fight of her life.
We've never done that before.
I
Pretty
know.
good.
That's awesome.
That is awesome.
It's the little things.
She was diagnosed in February with an aggressive form of inflammatory breast cancer. She started chemo on Valentine's Day and underwent a double mastectomy less than 6 weeks later. Dr. Alessandra Lal is her surgeon.
She is handling this phenomenally well, but you have to understand, to be 28 and given this diagnosis hits you out of left field. This is very hard even to accept the diagnosis, let alone face this very difficult treatment.
As a freelance photographer living in New York City, Amelia had no health insurance to ward off what quickly became a mountain of medical bills. So a group of her friends got together and did something very loving, very modern, and it turned out very effective. It's called crowdfunding, a booming niche of the U.S. economy that has raised startup money for small businesses, inventions, independent films, scholarships, and much more. In this case, for Project Amelia.
You must be astonished by the total, though, raised so far, right?
It's a lot of money.
Close to $50,000 and counting, money that almost matches what she owes. It was raised through a website called GiveForward.com.
We believe that people want to help people, and it's obviously the case in Amelia's case that there's just so many people out there who are rooting for her.
GiveForward.com started in 2008 as a fundraising tool for all sorts of things, but quickly narrowed its focus to medical expenses. And why not? The National Bureau of Economic Research found that half of American adults say they would not be able to easily come up with just $2,000 in case of a medical emergency.
We realized what a huge problem it really was in this country, and we shifted our focus to focus only on medical. We had about 300 fundraisers in the first year, and in the last 6 months we've had about 15,000.
Like similar sites, GiveForward makes money from small fees connected to the donations.
This travels so much faster than it ever could before because of Facebook, because of Twitter, because of social media.
It's not just friends and family donating, but long-lost acquaintances and even total strangers.
I think I was humbled by how many people reached out to me who didn't even know me. There are no words to describe that feeling.
Amelia is getting treatment in Milwaukee so she can be close to her immediate family, and she was able to get Medicaid to help cover upcoming expenses.
I sent her pictures.
She so far has had one surgery, but she will require additional surgeries.
Her doctors say reducing the financial burden has affected her recovery.
It shows a huge well of support for her, people she knows, people she doesn't know, who are all there for her, supporting her, not just emotionally, but also financially.
What does it say to you about the human spirit?
It's totally indestructible. It's totally here in full force. It gives me hope.
One more.
For CBS This Morning, Dean Reynolds, Milwaukee.
This feels really good.
Good.
See, once again, it affirms your belief in humanity. I've always thought that people want to help others and do the right thing.
Mm-hmm. Yeah, and I love that everyone has given so much to help Amelia.
And Kickstarter is great. Those kinds of crowdsourcing things are great ways to do it. They're very effective. Very cool.